Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I am very excited to introduce our guest today as we speak about the role of physical therapy plays in our health. Prior to becoming a physical therapist, Craig Cryer was a high school teacher and coach. For 31 years, he has been a physical therapist in the Houston metro area and is the owner of Cryer Therapy Services. Craig's company currently provides services or has clinical sites in partnership with Oak Bend Medical Center in Richmond at Oak Bend Hospital Jackson Street, Oak Bend Williams Way, Sugarland New Territory, and Wharton, and has 3 clinics in the Cy-Fair area, Fairfield, Spring, Cypress, and Bridgeland. He has been associated with Oak Bend Medical Center since 1999. Craig specializes in orthopedics and special interests in lower extremities, total joints, hips, knees, ankles, along with adult and youth sports injuries. Craig, welcome. We're glad to have you today.
Thank you, Donna. I'm excited to be here.
We've had COVID this year and all these things, and as we age, we hurt, we have injuries, we fall. And we think of physical therapy as exercise, but it's much more than that. Can you expand on that?
Sure. And I think if you start from that standpoint, physical therapy, if you go by what the first name is, it's physical. And I think we've progressed to it's not only physical for the patient, but also for the physical therapist. We emphasize physical activity and exercise. But it's more than just exercise. So you can go to a gym and do exercises, but for us, it's about educating and why you're doing an exercise and the purpose of that exercise. It's teaching. I always relate. It goes back to when I was a high school teacher. I mean, I value that ability to be able to educate and teach the patient because it's not just sending them to the gym. There are exercises that are specific to a problem, and being able to communicate that with that patient and educate them and teach them and get them to do it the right way with the proper technique is what it's all about. We also do manual therapy, which is a physical part from the physical therapist, and it's a direct connection to that patient. I think it's extremely valuable, and all of our therapists do some form of manual therapy. There's multiple kinds out there, but it's using your hands to affect a certain response from the patient and tissue. So those are the 2 big things that physical therapy is about. Or if you look at other, traditional things, there's modalities which we use to influence tissue reaction and healing and those so forth, like ultrasounds and electrical stim and dry needling. And, there's multiple things that are used as what we call modalities. But it's gotten a little bit away from that over my 31 years, certainly. We started off much more passive. And have progressed to a much more physical aspect. So physical therapy is really more complicated than it used to be. I jotted down the other day just a few of the different areas of expertise that you can have, and there are like almost 30 different areas that you could choose from. And we have, I think, probably close to 20 of those at Oak Bend at our various clinics. So every therapist can specialize in certain things like, neurological therapy or, people do pediatrics and geriatrics and nursing homes and inpatient, outpatient. I can go on and give you a whole list of them, but physical therapy is really much more complicated than just saying exercise.
And I noticed during COVID, your physical therapy team was a very positive help in getting our COVID patients better and up and out just by getting them mobile and moving and turning them and all those things.
That's right. What you realize is that physical therapy is a life or death issue. I'm passionate about that belief. If a person doesn't move, if they go into the hospital for whatever reason, and COVID was a significant reason, because there are breathing issues and they can't do anything at all, exert themselves. And so it's very, very important and vital actually to life to get them up and moving. Also, I think people that lay around and don't do anything also are more prone to depression and giving up. And I think it certainly gives them an outlet to be able to move and do things and to know that there's hope through that movement.
Exactly. And I know as we age, and some people just naturally have problems with dizziness, instability, and stuff. Do you have in the physical therapy realm anything to help with that?
Yes, we do. So vertigo, or if we do a general term, dizziness is a huge part of what we deal with in physical therapy. I actually looked up some numbers, and there are a significant number of our population is going to go through this at some point. Up to 40% of people that are 40 and older, and up to 90% or more of people who are 65 and over. So it is a significant thing. And the reason it's significant is because there are treatment methods for it, certainly, but it also leads to the propensity to fall. And as you get into the elderly population, that is a huge issue because that is a life or death issue when we're talking about falls. But let's go back to vertigo specifically. It's if you're having dizzy spells and they won't go away, it's probably a good idea to go to your ENT, and that's kind of a starting point, or your general practice physician, and get them to refer you to physical therapy. The physical therapist then can determine from there if they can help that patient, because there are a multitude of things that can cause dizziness, from medications to whatever. What we deal with in physical therapy is primarily two types. One is an inner ear issue. It's called benign paroxysmal positional vertigo, or BPPV. We also deal with head and neck issues. So, if you have something wrong with your cervical spine area, certainly we can treat that muscular wise. But if it's the BPPV, you need a specialist. And we do have one at Oak Bend. We have others in the Oak Bend system that also do that. And that has to do, and that's primarily as you age, it gets worse and worse. What it says in the name is position. Okay, so what we do is and I won't get too technical, but basically there are crystals that in the inner ear that gets dislodged, and they get into the fluid that moves around our inner ear canals, and it causes dizziness in its certain positions. And there's a maneuver called Epley maneuver, and physical therapists learn that in physical therapy school, and you don't learn really the specifics of everything, but you learn the basic techniques. And then if you decide to specialize in that after you get out, it's one of the things that you can stay plenty busy doing.
Awesome. So during this year, I think we can all agree this has been a year for people to be a little more sedentary. You haven't seen people exercising as much and all of that stuff. And it's important for everyone, but especially with people with heart disease, diabetes, COPD. They need to keep moving as much as they can, and they're scared, or they're not able to. What could physical therapy do for them that might be beneficial to the whole outcome of their life?
Yeah, well, I'll go back to the education part. And again, a physical therapist must have a heart of a teacher. And when you're dealing with people that are inactive, we realize what that can lead to in the future. All those problems you just mentioned, add in arthritis and add in all other kinds of issues. But a person that becomes inactive is likely to become more inactive over time. And so we need to educate these people to move, because that prevents so many other issues, medical issues across the board. But it also, a physical therapist's responsibility is not just to teach exercise, but to teach proper exercise and safe exercise. And so I typically tell people that if you come to me for exercise instructions, be prepared to learn. Because it's important that you know why you're doing something and how you're doing something. Again, there are other people that teach exercise, but I believe that we are the best at teaching that exercise with the proper techniques. And also, in addition to that, is kind of projecting out, what kind of exercises you need to be doing in the future, and kind of giving them a plan for that whole process.
So it kind of sounds like to me, for someone who's been sedentary for a very long time or has medical complications, arthritis, whatever, that you almost ought to start with physical therapy to kind
I
of help
totally,
you get. where
Yeah,
you
I
need to
agree,
go.
Donna, and because it's um, like again, if you go back and look at what exercise can help prevent or mitigate all these other things, it can help. Everything that you mentioned can be helped by exercise. And again, back to the original statement is that if you just go exercise, like I give a story. My sister started exercising one time, and she was walking like 10 miles within the first month. And I told her it won't last because you're going to have breakdown. And so if you don't temper that exercise, it's not just going full scale 100 miles an hour from zero. You have to start somewhere, gradually progress, and be patient and build an exercise program. And it's not all about going 100 miles an hour, because you create other issues when you do that. And when you create those other issues, whether you have pain, foot pain, back pain, whatever, then you're going to end up not doing anything again.
So you also have not just physical therapy, but you also have a workout area, correct?
That is correct. And that's so one of the things that we try to do is give people an outlet to come and exercise in an area that is very comfortable. It's called Lifestyles, and it's in our Jackson Street clinic in Richmond. We have physical therapists that you have access to their advice anytime you want it. And it's very, very low cost, especially for seniors. But for everybody, it's low cost, to less than what you would pay going to a normal gym. We have all the equipment that you would ever need. But we like to offer that to our patients because, again, we're trying to give them a comfortable area where they can come work out. I've discovered over the past that one of the things, like public speaking, if you have a fear of public speaking, you're not going to do it. If you have a fear of exercising and going to a gym because you're not going to look right, or you're afraid of what everybody's going to say about you or whatever, it's going to be harder to do that. So we give them this softer transition to come to Lifestyles, and it's been very successful.
Perfect. And I hope our listeners heard that, because it would be great to be able to transition with the people that you know doing physical therapy and then transition into a gym situation, which could be a win-win.
Yeah, and Donna, it also helps them to avoid future problems. If they feel something coming on, they feel like, oh, I have shoulder pain. That's kind of weird. It just started. They ask the physical therapist about it, and the physical therapist can watch their technique on whatever exercises they've been doing and making sure they correct it, and maybe mitigate that by having some exercise moderations or changes that will affect that particular joint.
Excellent. Now let's talk about the very foundation of us, our feet. And we see these women who walk in heels and complain about their feet and knees, and men who are on their feet and maybe not wearing the right shoes or whatever. What can we do with our feet?
Oh, there's lots. And it reminds me of there's a physical therapy course that's called When the Foot Hits the Ground, Everything Changes. And that is so appropriate, because that is exactly what happens. And so if you add in heels, let's just take that for a starter. You consider the ripple effect that it has on your whole body. You got probably up to 90% of your weight on the ball of your foot, which puts a tremendous amount of pressure on those bones and the soft tissue down there. And then what it does is it makes your knees bend just slightly. And so it's going to strain your calves, and it's going to strain your thigh muscles. And so those are going to fatigue more quickly, which makes it more likely that you're going to have problems. Lots of women have what we call anterior knee pain, which is an issue with the kneecap, how it interacts with the femur, which is the thigh bone. And that is a very, very common thing. But then you go up the chain, and you have the hips that have to change, and you have a back that has to have a bigger lordosis or arch in the low back. And it changes the center of gravity, it's a ripple effect that will affect all those joints. And not everybody's affected, but certainly it affects gait. It affects how you walk. It shortens your stride, which in the long run shortens your muscles. So it's a whole chain reaction thing that is really not very good. I have to tell you this story too. And the reason I remember it probably happened 20 years ago. I had two patients at the same time who had both had accidents due to high heels. One of them was trying on high heels in the store and was walking down the aisle, fractured her ankle. The other girl was a young girl who was coming out of a restaurant and twisted her ankle and fractured her ankle. I was seeing them at the same time, and I thought that was just kind of an oddity. Certainly, it makes your balance much less, and it definitely affects those other areas. And depending on how much you stand is also a big deal. But our feet take a pounding, and every time you take a step, it's multiple times more force through your feet. And when you normally hit with gait, you hit on your heel. Well, when you're walking in high heels, that throws that weight forward, where you're taking a lot of the force on the front of the foot, which is not built for that.
So people who are having foot pain, when is the time to talk to your doctor about maybe physical therapy?
I think that's a good question for any part of the body. When do you go? We don't want to create a culture of you go to every time you have a little pain here and there that you're going to go to the doctor. That certainly is not what we're trying to promote. You have to have some kind of reasoning behind it. And if something lasts too long or it prevents you from doing something that you like to do or what is a normal process for you, that is when it's time to go. And so I will tell you, though, most people wait too long. That is, I think, just a general rule. I read an article recently. It talked about knee replacement surgery. Most people wait too long because you lose part of your function before you deal with your problem. People ask me all the time, when do I have surgery? I say, when you can't do the things you love to do. You can't go for a walk. You can't get on the floor and play with your children or grandchildren or whatever. You can't get off the floor. So there's times, I think, the judgment is when pain won't go away. We all know the normal healing time of things is just a few weeks, right? I mean, 4 weeks, 6 weeks, 8 weeks, whatever. But it starts getting even longer than 3 or 4 weeks, and it affects how you're functioning. I think it's time.
Good afternoon, and welcome to our Oak Bend Medical Center Happy Hour podcast.
If you have
My name is Donna, and I am your host.
Which is causing
I am
numbness
very
and loss
excited
of feeling
to introduce
or
our
loss
guest
of function
today
in some,
as we
some
speak
bodily
about
function,
the role of physical
those are
therapy
way more
plays
important, and
in
you
our
need to
health.
get to the
Prior
doctor
to becoming a
as soon as
physical
possible for those
therapist,
things.
Craig Cryer was a high school teacher and coach.
Massage therapy.
For 31 years, he has been a physical
How does
therapist
that,
in the
or
Houston
does
metro
it
area
even
and is
fit
the owner
into the
of Cryer
physical
Therapy
here of
Services.
everybody going for massages?
Craig's company
Yeah,
currently
so
provides
if you want a
services
massage, if you
or
want
has
massage therapy,
clinical
you need to go to
sites in
massage
partnership
therapists.
with
They are
Oak
very
Bend Medical
skilled
Center
and talented in
in
what they do.
Richmond, at
Physical
Oak Bend
therapy,
Hospital,
it is
Jackson
a
Street,
very passive
Oak Bend
treatment.
Williams
It
Way,
has some great
Sugarland New
effects,
Territory, and
but
Wharton,
it's fairly,
and
for
has
us,
3
it's fairly
clinics in
short-term
the
effect.
Cy-Fair
We
area:
are more
Fairfield,
interested in
Spring,
the physical
Cypress,
part, and that is
and
part of the transition
Richland.
from physical
He has
therapy
been
from being a
associated
passive
with Oak Bend
kind of
Medical
thing to
Center
more
since
active.
1999.
I tout
Craig
massage therapy. I think
specializes
it's
in
fantastic
orthopedics and special
treatment.
interests in lower
But in physical
extremities,
therapy, we really
total
don't do
joints,
that much
hips,
anymore.
knees,
It's kind of an
ankles,
antiquated
along
thing
with
for
adult
us.
and youth
I would
sports
probably prefer
injuries.
them to get them
Craig,
to a massage
welcome.
therapist where
We're
they
glad
can get
to have you today.
full body
Donna.
full massage for whatever it is, 30
We've
minutes,
had
an hour,
COVID
whatever.
this year
we do
and
not
all these
do
things,
that.
and as we age, we
Okay,
hurt.
so Cryer,
We
I
have
thought y'all
injuries,
had
we fall.
massage therapy.
And
We do. We have a
think of
massage
physical
therapist.
therapy as
Exactly.
exercise.
As part of
But it's
lifestyles, we
much
have a
more than
massage
that.
therapist
Can you
that will
expand
spend
on
that
that?
hour with you.
Sure.
And I think
and
do that. If you start from that standpoint,
So
physical
it's a
therapy,
one-stop shop.
if you go by
That's
what
right.
the first name
We try
is, it's
to.
physical. And I think
that's how we've developed our
we've
program.
progressed to. It's not only
is,
physical
people
for the
come to us,
patient,
we
but also
realize
for the
there are
physical
important
therapist.
aspects of
We
physical therapy that we need
emphasize
to have, no matter what.
physical activity.
But if somebody
and
brings
exercise.
something to us,
But it's more than just
"Oh, you ought to
exercise.
have
You can
this,"
go to a
then we will
gym
look
and do
into it.
exercises.
It's kind of like,
But for us,
women's
it's about
health program
educating
or
and
whatever.
why you're doing
And
an
if somebody
exercise and the
brings
purpose
something
of that
to us,
exercise. It's
and we
teaching.
can
Investigate
I always
that.
relate
and
it
it's
goes
something
back
that we can
to
deliver.
when I was a
will.
high school teacher. I mean,
So we've talked
value
about all of our
that
aches and
ability
pains as
to be able
adults
to
and
educate
everything.
and teach the
But we
patient.
have so
Because
many
it's not
kids
just sending them to the
today
gym.
in
There are
sports,
exercises that are
all kinds of
specific to a
sports.
problem.
And then there is
And being able to
specialized
communicate that with
sports and
that patient
all
and
this.
educate
And
them
I
and
have
teach them
granddaughters
and
that
get them to do it the
play,
right way with the proper technique is what it's
they're
all about.
pitchers.
We
So
also
they're pitching
do
3-4
manual
games and
therapy,
their
which is the
shoulders are
physical part
hurting
from the
and they're
physical
maybe
therapist, and
13,
it's a
14
direct
years
connection
old.
to that patient.
Or
I
their
think it's
feet start
extremely
to hurt or
valuable,
their
and
back
all
or
of our
their knees.
therapists do some
What do we
form
do
of
for our
manual
kids?
therapy.
How can
There's
physical
multiple
therapy
kinds
help
out there,
them?
but it's
Well,
using your hands to
that
affect
is
a
one of the
certain
best
response
questions
from
you've
the
asked,
patient
because
and tissue.
you know, I am
So
pretty
those are
passionate
the two
about
big
that
things
and youth
that physical
sports
therapy
and
is about.
obviously
If
my
you look
children went
at
through that.
other, traditional
one of
things,
the
there's
things that parents have
modalities
to
which
realize
we
is you
use
never
to
go from 12
influence
years
tissue
old to the
reaction
majorly
and,
healing and so
to the
forth, like
NFL,
ultrasounds
whatever.
and electrical
It's a
stim
development
and
process.
dry
And
needling
so,
and
there's
um,
multiple things.
just
that
because
are
you can
used
throw
as what we call
115 or
modalities.
120
But it's
pitches
gotten a little bit
as
away
a
from that
12-year-old doesn't
over
mean
my
you're going to
31
make it
years,
major.
certainly.
I
We
think
started
we
off
have
much more
to
passive.
look back and what is
And
best
have
for our
progressed
children
in much more
and
physical
youth
aspect
is to give
So
them
physical
variety
therapy is really
and
more
not overuse
complicated
these
than it
things.
used to be.
I have
I
seen
jotted
it happen
down
to
the
young
other day
people
just a few
many times
different
over the
areas
years
of expertise
where
that
their
you
parent,
can have, and they're
I think
like
out
almost
of
30 different
some of it
areas
is
that you
is
can
out
choose
they want
from.
to give their children every
And
opportunity
we have,
possible, and I
I think
understand
probably
that.
close to 20
And
of
that's
those
a
at
beautiful
Livin
thing.
at our
But
various
on the other
clinics.
hand,
So every
you also
therapist
want to be
can specialize
realistic
in certain things,
and look
like,
at your child and give a
neurological
variety of
therapy
experiences.
or,
I believe it
people do
starts
pediatrics
with
and
letting
geriatrics and
children play
nursing
multiple
homes and
sports
inpatient,
where they can use
outpatient.
their
There's-
muscles
I can
differently.
go on and give you a whole
develop
list
different
of them.
skills. And
But
overall,
physical therapy is really
athleticism
much more
instead
complicated
of just
than just
one
saying
thing all the
exercise.
time. And I
And I
understand
noticed
too
during
that people will
COVID,
tell you,
your
"Oh, if you
physical
don't go this
therapy
route, you're not going to
team
get a college
was a
scholarship." And that
very
is certainly
positive help
upsetting
in
and
getting our
disappointing
COVID
that it has to
patients
be
better
that way.
and up and out
I
just by
believe
getting
in
them mobile
overall
and
skills.
moving and
Every
turning
sport
them
develops
and all
skills
those
differently,
things.
and a
That's right.
baseball player
What
can
you
benefit
realize is
from
that,
basketball skills
physical
and what they
therapy
learn from
is a
playing
life or
basketball
death
and what they
issue.
can learn from playing
I'm
tennis
passionate
or
about
whatever.
that belief.
So each of these,
If a person
sporting
doesn't move,
events
if they go into the
develops your
hospital
skill level
for whatever reason,
and develops
COVID
quickness,
was a
develops
significant
speed,
reason,
develops agility,
because
develops
there's
breathing
different
issues,
muscles,
and
they
so
can't do anything
to me, having
at
a
all
variety of
exert
sports,
themselves.
much rather
So
have
it's
a multi-sport
very
athlete
important and
than you
vital
would somebody
actually
who just
to
grinds
life,
away on the same thing
to get them
year,
up and
all
moving
year
also
after year.
think people that lay
I also
around and
think
don't do anything.
it's already been
Also
proven,
are
and
more
Little League
prone
has
to depression
taken some steps
and
to
giving
address
up.
it. About,
And I think it
pitching
certainly
limits
gives them an
so
outlet
to
to
be
be
able
able
to
to
move
move
and
and
do
do
things,
things,
and to
I
know
think
that there's
now
hope through
so
that
I think
movement. In baseball, pitching limits
Exactly.
and things
And
that
I know as we
control, from the
age
outside.
and
But I think
some people
common
just
sense, for the most
naturally
part,
have
does that.
problems with
And I think parents
dizziness,
need to realize
instability, and
that
stuff.
their
Do you
child,
have in the physical
again, is
therapy
not going to go
realm
to the major leagues from being
anything to
12 years
help
old.
with
I had
that?
a young man,
yes, we do.
12-year-old
So vertigo,
pitcher,
or if
and
we
had
do
elbow
the
problems.
general term
And his
dizziness,
parents were upset because he
is
wasn't going to be able to go to a
huge
lesson
part of what
and
we
wasn't
deal
able to
with in
pitch.
physical therapy.
And I actually
That's
looked
what I
up some
told him. I
numbers,
said,
and
"Look,
there
he's 12
are
years old.
a
Let him
significant
develop."
number of our population
And,
that's going to go through this at some
he may
point.
be a major league
Up
pitcher
to
one day,
40%
but
of
let him
people that are
develop
40 and older,
overwhelm his
and
body.
up to 90% or more.
Anyway, that's
of
the
people
best
that are
advice I can
65
give.
I probably have a lot of
So
tomatoes
it is
thrown
a
at me,
significant
but
thing.
it's
And the reason
one
it's
of those
significant
things that is
I
because
just,
there are
treatment
particularly as a
methods for
parent
it,
who went through
certainly,
some of those decisions.
but it also
leads
things
to the propensity to
allowing
fall.
them to play
And
multiple
as you
sports.
get into
Like
the
when I
elderly
was young,
population,
our whole group, we
that is
played
a
every
huge
sport that
issue
was available
because that
year
again, that is
round.
a life or death
And so,
issue when we're talking about falls.
I realize you can't.
But let's go back to vertigo specifically.
I think certainly
It's
we need to
if
realize
you're having dizzy
that our children
spells
need to grow and
and
develop,
they won't go away,
need not be
it's
in
probably
one line, one straight
a
path.
good idea to go to your ENT,
So, Craig, in the
and that's
case
kind of a
that we
starting
do
point,
have
or your general practice
a child
physician, and
who
get
is
them
having some
to
pain in
refer
their
you
shoulder
to
or
physical
stuff,
therapy.
is it
The
wise
physical therapist
to
then can
talk to
determine
the
from there
orthopedic or
if
the
they can help that
pediatrician
patient, because there are a
about should I
multitude of
get some
things that can cause
therapy for them?
dizziness.
I
From
think
medications
the first
to whatever.
sign of any
What
kind of
we
issue
deal with in physical
and
therapy,
it
is
may, parent has to
primarily
pay attention to the
two
child.
types.
The
One is
face,
an inner ear issue.
their
It's called
expressions,
benign
what they're going
paroxysmal
through,
positional
what they're
vertigo,
saying.
BPPV.
There's a lot of
We also
young
deal
people
with
too
head and
that
neck
will
issues.
push
So,
through things that hurt.
if you have something
So
wrong
I
with your
definitely think you
cervical
get it
spine
dealt with
area,
early. Certainly,
and
we
you
can
protect
treat
that
that
muscular
child
wise
for later
But
years.
if
I mean, you're
it's the
protecting your child
BPPV,
for their high
you
school
need a
years, and potentially college.
And we
and
do
whatever.
have one at Oak Bend.
And so I think
we
if
have
you
others
let
in the
things
Oak Bend
go,
system that
that's
also
when
do
other
that.
problems start
And that
to
has
develop.
to do, and that's
There's
primarily
back
as you
in the day.
age,
I'm
you
going to go
gets
back
worse and
way
worse.
back on the story.
What
Does
it
he
says
deem
in
the
the
name
major
is
league
position?
pitcher.
Okay,
And
so
what
line
we do is
drive,
he
they're
was really good,
and I won't
line
get too
drive
technical,
his
but
foot.
basically there are
He kept
crystals
trying to pitch,
that
and
in
he
the
entered his
inner ear
career.
that gets
His arm
dislodged,
gave out. and they
because he
get
was
into the
changing
fluid
his mechanics
that
and
moves
changing
around
the way
our
it
inner
did
ear
things.
canals.
Well, when you're a
And
youngster,
causes
muscles are
dizziness
just
in
developing
certain
your
positions.
growth plates are
And there's
still
a maneuver
involved,
called Epley
and
maneuver.
you're trying to
And,
alter the way you throw.
physical therapists learn that in
can be
physical
a
therapy
mess.
school.
And so
and
you can get
you
to a
don't
physical
learn
therapist
really the
the
can
specifics of everything,
teach
but
some
you
things, teach
learn
you
the basic
how to do
techniques,
exercises
and
and to
then
correct
if you
muscle
decide
imbalances.
to specialize in that
we have
after you
a
get out,
therapist at Oak Bend that
it's
does
one of the
throwing
things that works with athletes
stay
that throw.
pretty busy doing.
And so all those things entail
Awesome.
a complete
So
program that I
during
think can
this
help
year, I
someone
think
to
we
learn.
can all
Again, it's
agree this has
educating
been
them.
a
And the
year
more
for
that
people to
young
be a little
person,
more
even
sedentary.
10, 11,
You
12,
haven't seen
13,
people
it's all
exercising
going to be
as
a situation
much
where they're
and
learning the
all
whole
of
time.
that
And so the
stuff.
more they
And
can learn about their
it's
body, the
important
better
for
they're going to
everyone, but
perform later
especially
on.
with people with
And
heart
enjoy the
disease,
sport.
diabetes,
Absolutely.
COPD.
Absolutely. It's not a
They
grind.
need
It's
to
supposed
keep
to be a
moving
pleasure.
as much as they can,
Yes,
and they're
yes. So
scared
one last
or
question for you.
they're not
Yes.
able to.
You hear
What could
everybody
physical
talk about
therapy
flat
do for
feet.
them
I have
that
flat
might be
feet, or I
beneficial
have
to the whole outcome of
this
their
or
life?
that.
Yeah, well, I go back to
What
the
does that
education part.
exactly mean?
And again, a
And do you
physical
need to do
therapist must have
something
a
about
heart of
it?
a teacher. I guess the short answer is maybe.
Dealing with people that are inactive.
It's called pes
we
planus,
realize what that can
and there's
lead to
pes
in the
cavus,
future.
which
All those
is what I
problems you
have.
just
I have a
mentioned.
really
Add
high
in
arch,
arthritis, and add in
pes
all
planus,
other
is
kinds of
foot is
issues.
flat, but a person that
which my
becomes
son has,
inactive
it
is
hasn't-
likely to become
he hasn't
more
had any
inactive
problems
So I
over
think
time.
a lot of that is,
And so
are you
we
having
need
to
problems
educate
with
your
your
people
feet.
to move?
because
So
that prevents
so
if
many
I
other
were having
issues,
pain
medical
in my
issues
feet,
across
I think
the
that's
board.
certainly something
But
you
it
want
also,
to address.
physical therapists,
There are orthotics out there that are
stretching
not just to teach
exercises that may
exercise, but
help
to
with
teach
that
proper exercise
a little
and
bit,
safe exercise.
but we're all
And
built
so
differently. I typically tell
and
people that
it depends on if you're having
you come to me
problem
for
with that
exercise
foot.
instructions.
If you're not having
Be
with that
prepared
foot,
to
I
learn.
probably wouldn't mess with it.
Because it's
That's
important
just my,
that you
that's
know
kind of
why
more of
you're
an
doing
opinion.
something and how you're doing something.
I've just always heard about
Again,
flat
there
feet. and wanted
there are other people
to ask
there.
the
I see
question.
I see a
But I
lot of
believe
feet.
that
Okay,
we
and
are
so
the best at
and
teaching
they're
that
all
exercise
different.
with the
You
proper
do a test, you
techniques.
have patients stand
And
there, and
also,
you
in
look at their
addition
arch,
to that,
and you look at where their heel is positioned,
kind of
everybody's
projecting
foot
out,
is different. What kind of exercises
Is there
you need to
one
be doing
thing
in
you
the
would like
future,
the
and kind of giving them a
audience to
plan
know?
for that whole process. To
So it kind of
reemphasize
sounds like to
this,
me,
the
for
longer
someone
you
who's been
have something that
sedentary
is
for a
giving you
very
a
long
problem,
time or
the
had
harder it is to get
medical
rid of it.
complications,
Okay, physical
arthritis,
therapy
whatever,
is
that you
known as
almost
kind
ought
of
to
a
start
slow
with
process,
physical
and it's not
therapy
always that way.
to
The
kind of help
process
you
is
get
slower when I get somebody
Yeah, I
who's
agree,
had
Donna.
pain
And
for 20 years,
and because it's
and they haven't said
um,
anything, they've just
like
endured
again,
it.
if you
And
go
going
back and
through
look
it,
at what
they would have been
exercise
much
can
better
help prevent
dealing
or
with
mitigate
it at a year or 2
all
years,
these other
even,
things. It
or
can
6
help.
months or 6
Everything
weeks.
that you
And
mentioned
so
can be helped by
deal with
exercise.
issues in a
And
quicker
again, back to the
manner, and they
original
go away
statement is
quicker.
that if you
Also
just go
realize
exercise,
this,
like
every time you
I get a
have,
story. My sister
let's just take back
started
pain.
exercising
One
one
time,
time.
one
and
of
she was
this is a
walking
very,
like 10
very
miles
common thing.
within
Is somebody
the
that has
first
back
month.
pain,
And I
and
told
it will
her
go away in a
it
day or
won't
two.
last.
Then
Then
you're
you're
going to
6
have
months later,
breakdown.
they have back
And
pain
so if you
again,
don't
and it
temper
takes
that
3 or 4
exercise,
days.
it's not just going
A
full
year
scale,
later, they have
100
it,
miles
and
an
it
hour
takes
from 0.
2 weeks to go
You
away.
have to start somewhere.
So
If
gradually
they recognize
progress,
each one of those episodes
and
is
be
becoming a
patient
little bit more
and
severe,
build an
and
exercise
it's taking
program,
longer to go
and
away.
it's not all
You
about
need to
going
get
100
help.
miles an
You
hour
need to
because
get
somebody
other
to
issues
teach
when
you
you do that.
proper
Stretching
stretching
exercises. Those other issues,
I'm
when
going to
you
tell
have
you the
pain,
truth.
foot pain, back
Like
pain,
back
whatever,
issues are
then you're
very
going to end up
basic
not
and
doing
very
anything
easy
again.
to take care of if you deal
So
with it in a timely
you
manner.
also
It's
have not
it's
just
the people
physical
that don't
therapy,
deal with things. They don't
but
want to
you
go to
also
the
have
doctor.
a
They don't want to
workout
take off
area,
work. They don't want, I
correct?
mean, there's a lot of
That is
different
correct.
reasons, right? And that's
But
so one
if
of the
you
things
deal
that
with
we try to
issues
do is
sooner,
give people
you
an
get better
outlet
quicker.
to come and
And it's
exercise
easier.
in an area that is very
Awesome.
comfortable. It's called
Craig, it has
Lifestyles,
been a
and
pleasure
it's
to
in
have
our
you here
Jackson Street
today.
clinic in Richmond. We
I'd
have
like to have you
physical
back because
therapists
I
that
think
you
there's a
have
lot more
access to their
things our
advice
audiences
anytime you
can
want,
learn,
and it's
including
very, very
myself.
low cost, especially for seniors.
Personally, I want to say
But
how
for everybody,
grateful I
it's low
am
cost to
to
less than
Crier
what you would
Therapy
pay going to a
Services.
normal
Craig
gym.
probably doesn't
We have all the
realize it,
supplement
but he
you,
has
whatever you
treated
need.
3
But we like to offer
generations
that to our patients
of my
because,
family over the
again, we're trying to
years.
give them a
And
comfortable
he
area where they
has
can come work
added
out.
to
I've
their
discovered over
life
the past
in a
that
very
one of
positive
the
way.
things,
He's
like
got an
public speaking, if you
exceptional
have a
staff,
fear of public speaking, you're not
and
going to do
we're
it. If
grateful
you have
to
a
have
fear of
him
exercising and going to a gym
as
because
a
you're not going
partner with Oak
to
Ben.
look right,
It's
or
been a great
you're afraid of what
relationship, and
everybody's
our
going to say
patients have
about you or
truly
whatever, it's
benefited
going to be
from it.
harder to do that. So we
So I
give them
want
the
to thank
softer
you for that.
transition to come to
Remember, if you
lifestyles,
need a
and
physical
it's been
therapy
very successful.
appointment, Ask your doctor. Perfect.
Tell him
And
you
I
wanna
hope
go
our
to
listeners
Prior
heard
Services.
that because
They know exactly
where he is
to
and
be
how
able
to
to
make
transition
it happen.
with the people that
We'll also be
doing
providing
physical
you their phone
therapy,
numbers if you
and then
need additional
transition into a
information. Check them out. They're
situation,
always
which
welcome
could be a
to talk to
win-win.
you.
Yeah.
So
And
thank
Donna,
you
it
again,
also
Craig,
helps
for
them
joining us
to
today.
avoid
A
future
big
problems.
thank you to our
If they feel
listeners for
something coming
tuning
on,
in.
they feel like, oh, I have
Beginning
shoulder
now,
pain. That's kind of
set
weird.
an
It just started.
intention and a
They ask the
relentless
physical
focus
therapist about it,
on
and the
living
physical
your
therapist
life
can
as the
watch their
greatest
technique on
person you
whatever
can be
exercises
in
they've
all
been doing, and
situations.
making sure they
Please
correct
join
it
us
and
next week.
maybe mitigate that by having some exercise moderations or changes that will affect that particular joint.
Excellent. Now let's talk about the very foundation of us.
Thank you for joining us today on Oak
And
Bend
we
Medical
see these
Center
women
Happy
who
Hour
walk in
podcast.
heels
We hope
and
you enjoyed today's broadcast
complain
and
about
invite you
their
to email us
feet
at
and knees, and
oakbendhappyhour
men
podcast
who are on their
at
feet and maybe not wearing the right
with
shoes or
any
whatever.
questions
What
or
can we do with
topics
our
that you would
feet?
like for us to cover.
Oh, there's lots.
Remember,
And
you can
it
find
reminds
us
me
here
of
each Friday at
there's a
5.
physical therapy
Until next week,
course
be
that's
mindful
called When the
and
Foot
stay
Hits
healthy.
the Ground, Everything Changes. And that is so appropriate because that is exactly what happens. And so if you add in heels, let's just take that for a starter. You consider the ripple effect that it has on your whole body. You got probably up to 90% of your weight on the ball of your foot, which puts a tremendous amount of pressure on those bones and the soft tissue down there. And then what it does is it makes your knees bend just slightly. And so it's going to strain your calves and it's going to strain your thigh muscles. And so those are going to fatigue more quickly, which makes it more likely that you're going to have problems. Lots of women have what we call anterior knee pain, which is an issue with the kneecap, how it interacts with the femur, which is the thigh bone. And that is a very, very common thing. But then you go up the chain and you have the hips that have to change, and you have a back that has to have a bigger lordosis or arch in the low back. And it changes the center of gravity it's a ripple effect that will affect all those joints. And not everybody's affected, but certainly it affects gait. It affects how you walk. It shortens your stride, which in the long run shortens your muscles. So it's a whole chain reaction thing that is really not very good. I have to tell you this story too. And the reason I remember it probably happened 20 years ago. I had two patients at the same time who had both had accidents due to high heels. One of them was trying on high heels in the store and was walking down the aisle, fractured her ankle. The other girl was a young girl who was coming out of a restaurant and twisted her ankle and fractured her ankle. I will see them at the same time, and I thought that was just kind of an oddity. Certainly, it makes your balance much less, and it definitely affects those other areas. And depending on how much you stand is also a big deal. But our feet take a pounding, and every time you take a step, it's multiple times more force through your feet. And when you normally hit with gait, you hit on your heel. Well, when you're walking in high heels, that throws that weight forward, where you're taking a lot of the force on the front of the foot, which is not built for that.
So people who are having foot pain, when is the time to talk to your doctor about maybe physical therapy?
You know, I think that's a good question for any part of the body. When do you go? We don't want to create a culture of you go to every time you have a little pain here and there that you're going to go to the doctor. That certainly is not what we're trying to promote. You have to have some kind of reasoning behind it. And if something lasts too long or it prevents you from doing something that you like to do or what is a normal process for you, that is when it's time to go. And so I will tell you, though, most people wait too long. That is, I think, just a general rule. I read an article recently. It talked about knee replacement surgery. Most people wait too long because you lose part of your function before you deal with your problem. People ask me all the time, when do I have surgery? I say, when you can't do the things you love to do. You can't go for a walk. You can't get on the floor and play with your children or grandchildren or whatever. You can't get off the floor. So there's times, I think, the judgment is when pain won't go away. We all know the normal healing time of things is just a few weeks, right? I mean, it can be 4 weeks, 6 weeks, 8 weeks, whatever. But if it starts getting even longer than 3 or 4 weeks, and it affects how you're functioning, I think it's time probably to do that. Now, there's exceptions to that. If you have an issue which is causing numbness and loss of feeling or loss of function in some bodily function, those are way more important, and you need to get to the doctor as soon as possible for those things.
So, massage therapy, how does that, or does it even fit into the physical therapy? You hear of everybody going for massages.
Yeah. So if you want massage therapy, you need to go to a massage therapist. They are very skilled and talented in what they do. Physical therapists, it is a very passive treatment. It has some great effect, but it's fairly short-term effect. We are more interested in the physical part, and that is part of the transition from physical therapy, from being a passive kind of thing to more active. I tout massage therapy. I think it's a fantastic treatment. But in physical therapy, we really don't do that much anymore. It's kind of an antiquated thing for us. I would probably prefer them to get them to a massage therapist where they can get a full body or full massage for whatever it is, 30 minutes, an hour, whatever. And we do not do that.
Okay, so I thought y'all had massage therapy.
We do. We have a massage therapist. Exactly. Okay. As part of Lifestyles, we have a massage therapist that will spend that hour with you and do that particular treatment regimen.
So it's a one-stop shop.
That's right. We try to, and that's how we've developed our program. Is people come to us and we realize there are important aspects of physical therapy that we need to have, no matter what. But if somebody brings something to us, oh, you ought to have this, then we will look into it. It's kind of like our women's health program or whatever. If somebody brings something to us and we can investigate that and it's something that we can deliver, then we will.
So we've talked about all of our aches and pains as adults and everything, but we have so many kids today in sports, all kinds of sports. And then there is specialized sports and all this. And I have granddaughters that play, and they're pitchers. So they're pitching 3-4 games and their shoulders are hurting and they're maybe 13, 14 years old.
Right.
Or their feet start to hurt or their back or their knees. What do we do for our kids? How can physical therapy help them?
Well, that is one of the best questions you've asked, because I am pretty passionate about that and youth sports. And obviously my children went through that. And one of the things that parents have to realize is you never go from 12 years old to the major leagues, to the NFL, to whatever. It's a development process. And so just because you can throw 115 or 120 pitches as a 12-year-old doesn't mean you're going to make it to the majors. I think we have to look back, and what is best for our children and the youth is to give them variety and not overuse these things. I have seen it happen to young people many, many times over the years where their parent, I think out of, some of it is out of, they want to give their children every opportunity possible. And I understand that. And that's a beautiful thing. But on the other hand, you also want to be realistic and look at your child and give them a variety of experiences. I believe it starts with letting children play multiple sports where they can use their muscles differently and they can develop different skills and overall athleticism instead of just one thing all the time. And I understand too that people will tell you, oh, if you don't go this route, you're not going to get a college scholarship. And that is certainly upsetting and disappointing that it has to be that way. But I believe in overall skills. Every sport develops skills differently. And a baseball player can benefit from basketball skills and what they learn from playing basketball and what they can learn from playing tennis or whatever. So each of these sporting events develops your skill level and develops quickness, develops speed, develops agility, develops different muscles. And so to me, having a variety of sports, I'd much rather have a multi-sport athlete than you would somebody who just grinds away on the same thing year after year. I also think it's already been proven, and Little League has taken some steps to address it, about pitching limits, so they have that in high school as well. I think now. So I think in baseball, pitching limits and things that control, from the outside. But I think common sense, for the most part, does that. And I think parents need to realize that their child, again, is not going to go to the major leagues from being 12 years old. I had a young man, 12-year-old pitcher, and had elbow problems. And his parents were upset because he wasn't going to be able to go to a lesson and wasn't be able to pitch. And that's what I told him. I said, look, he's 12 years old. Let him develop. And, he may be a major league pitcher one day, but let's let him develop and not overwhelm his body. Anyway, that's the best advice I can give. I probably have a lot of tomatoes thrown at me, but it's one of those things that I just, particularly as a parent who went through some of those decision-making things, allowing them to play multiple sports. Like when I was young, our whole group, we played every sport that was available year round. And so I realize you can't put that back in the barn, but I think certainly we need to realize that our children need to grow and develop and need not be in one line, in one straight path.
So, Craig, in the case that we do have a child who is having some pain in their shoulder or stuff, is it wise to talk to the orthopedic or the pediatrician about, should I get some therapy for them?
I think absolutely. The first sign of any kind of issue, and it may, a parent has to pay attention to the child, the face, their expressions, what they're going through, what they're saying. There's a lot of young people too that will push through things that hurt. So I definitely think you get it dealt with early, and you protect your child for later years. I mean, you're protecting your child for their high school years and potentially college and whatever. And so I think if you let things go, that's when other problems start to develop. There's back in the day, I'm going to go way back on a story. Dizzy Dean was a major league pitcher, and a line drive, he was really good. Line drive hit his foot. He kept trying to pitch, and it ended his career. His arm gave out because he was changing his mechanics and changing the way he did things. Well, when you're a youngster, muscles are just developing, your growth plates are still involved, and you're trying to alter the way you throw, and it can be a mess. And so you can get to a physical therapist who can teach some things, teach you how to do exercises and to correct muscle imbalances. And we have a therapist at Oak Bend that does throwing, works with athletes that throw. And so all those things entail a complete program that I think can help someone to learn. Again, it's educating them. And the more that young person, even 10, 11, 12, 13, it's all going to be a situation where they're learning the whole time. And so the more they can learn about their body, the better they're going to perform later on.
And enjoy the sport.
Absolutely. Absolutely. It's not a grind. It's supposed to be a pleasure.
Yes, yes. So one last question for you.
Yes.
You hear everybody talk about flat feet. I have flat feet, or I have this or that. What does that exactly mean? And do you need to do something about it?
I guess the short answer is maybe. It's called pes planus, and there's pes cavus, which is what I have. I have a really high arch. Pes planus is the foot is flat, which my son has. He hasn't had any problems. So I think a lot of that is, are you having problems with your feet? So if I were having pain in my feet, I think that's certainly something you want to address. There are orthotics out there. There are stretching exercises that may help with that a little bit, but we're all built differently. And it depends on if you're having problem with that foot. If you're not having that with that foot, I probably wouldn't mess with it. That's kind of more of an opinion.
I've just always heard about flat feet and wanted to ask the question.
I see a lot of feet. Okay. And so, and they're all different. You do a test, you have a patient stand there and you look at their arch and you look at where their heel is positioned. Everybody's foot is different.
Is there one thing you would like the audience to know?
To reemphasize this, the longer you have something that is giving you a problem, the harder it is to get rid of it. Okay. Physical therapy is known as kind of a slow process. And it's not always that way. The process is slower when I get somebody who's had pain for 20 years and they haven't said anything. They've just endured it and gone through it. They would have been much better dealing with it at a year or 2 years even, or 6 months or 6 weeks. And so deal with issues in a quicker manner and they go away quicker. Also realize this, every time you have, let's just take back pain. This is a very, very common thing, is somebody to have a back pain and it will go away in a day or two. Then 6 months later, they have back pain again and it takes 3 or 4 days. A year later, they have it and it takes 2 weeks to go away. So if they recognize each one of those episodes is coming a little bit more severe and it's taking longer to go away, you need to get help. You need to get somebody to teach you proper stretching exercises. Because I'm going to tell you the truth, like back issues are very basic and very easy to take care of if you deal with it in a timely manner. It's the people that don't deal with things. They don't want to go to the doctor. They don't want to take off work. There's a lot of different reasons, right? But if you deal with issues sooner, you get better quicker and it's easier.
Awesome. Craig, it has been a pleasure to have you here today. I'd like to have you back because I think there's a lot more things our audiences can learn, including myself. Personally, I want to say how grateful I am to cryotherapy services. Craig probably doesn't realize it, but he has treated 3 generations of my family over the years. And he has added to their life in a very positive way. He's got an exceptional staff, and we're grateful to have him as a partner with Oak Bend. It's been a great relationship, and our patients have truly benefited from it. So I want to thank you for that. Remember, if you need a physical therapy appointment, ask your doctor. Tell him you want to go to Cryo Services. They know exactly where he is and how to make it happen. We'll also be providing you their phone numbers if you need additional information. Check them out. They're always welcome to talk to you. So thank you again, Craig, for joining us today. A big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.